Okay, today's lesson, causes of infertility in men and women. We need to understand the causes, you need to understand treatment options available. As you watch this clip, be aware you have to use the PowerPoint in Show My Homework to play the hyperlinks to the videos that are embedded in this particular PowerPoint. Okay, you should be aware that both genders have issues with infertility. Statistically, men tend to be more infertile than women, but with regards to infertility, both sexes are affected. Some are male and some are female issues. You need to be aware of the different problems with each gender. One couple in 6 have problems starting a family when they want one. You should now play the clip Infertility, and as you watch the clip, you should make notes. You should now watch the clip Female Issues, and you should make a list of the issues that affect female infertility. Conditions that affect women's fertility can include damage to the fallopian tubes, ovulation problems, endometriosis, and conditions affecting the uterus, or a combination of factors, and in some cases no identifiable reason at all. If you do not understand any of these terms, you should take time now to research them. Some points to add if you haven't found. Damaged fallopian tubes. This could be genetic conditions. This could be due to drink. This could be due to drugs. Damaged fallopian tubes can be a result of STI, sexually transmitted infections. Chlamydia is one of the worst ones for making women infertile. Obviously, it is an STI where women and men who actually have contracted the infection do not know they have actually contracted it, and in the case of women it can actually render them infertile by damaging the reproductive tract. This has an impact obviously with the ovulatory problems. Ovulatory problems can be hormonal. There are other conditions which can affect that, and I will touch on that in a little while. Endometriosis is a additional womb lining. It thickens the womb, it makes periods very painful. Also, with regards to endometriosis, the actual parts of the lining of the womb can actually be spread throughout the body. So during the monthly cycle, the condition is very painful for women. Conditions can obviously affect the uterus. They can be linked obviously with the fallopian tube. They could be linked with the hormones FSH, LH, estrogen and progesterone. So hormones can have an effect on obviously the uterus itself. There could also be damage to the uterus during pregnancy and after a birth, which can sometimes go undetected. And obviously the combination of factors, it depends on what stage women are at in their reproductive cycle and in their life with regards to having children. Okay, other issues that affect women's infertility. Age. Fertility in women sharply declines after the age of 35. Women are more fertile between the ages of 14 and 18 at the start of obviously menstruation cycle up to the age of 18. Age, obviously, with regards to age, the older the lady is when conception takes place, if starting a family later in life, the more likelihood there is of the child being born with Down syndrome. This is a high risk, especially in women over the age of 33. Polycystic ovary syndrome, PCOS, and pelvic inflammatory disease, PID, are conditions of the ovaries, polycystic ovary syndrome. Many women, it is quite common to have cysts. Anything over the size of 7 millimeter, if it doesn't reduce after every cycle, is monitored and can be removed. With regards to polycystic ovary syndrome, it can have an impact on whether females actually do conceive. Victoria Beckham suffers from this particular condition and actually became public of this condition because it is an issue for women who try to actually conceive. Polycystic ovary syndrome can be controlled, the pain especially, with regards to hormone treatment, so that's the pill. And as I said, it isn't uncommon for women to actually have cysts on their ovaries. It's perfectly natural. Many women do not know that it actually happens, but it can become a problem when they're over 5 millimeters in diameter. Pelvic inflammatory disease, a condition. All these conditions can have issues with regards to the menstrual cycle and are painful. Obviously, gynecological problems such as ectopic pregnancy or having one miscarriage. If a woman who's had a miscarriage does not go and have what they call a D&C after the miscarriage, the lady can actually have problems conceiving again. With regards to ectopic pregnancy, if that's not identified, the baby can actually start to develop in the fallopian tube, and that can actually cause the fallopian tube to rupture and can be fatal. So 2 nasty conditions there. Some ladies, if they have a miscarriage, if it's not due to ill health issues with the fetus developing, such as a pregnant lady coming into contact with somebody who's carrying German measles, can cause obviously the lady to miscarriage. It could be a genetic condition. It could be also a result of the lady's own immune system, which will cause her to miscarriage on every occasion, and these situations have to be carefully controlled. Medical conditions such as diabetes, epilepsy, thyroid and bowel diseases can also affect the fertility of women. Also, it's possible for the fallopian tubes to be blocked. This can be something that ladies aren't aware of until they try to start a family, but STIs can cause a problem with this. And menopause. Menopause generally in women doesn't start until late 40s. That's still classed as early onset. Generally by the age of about 55, menopause may have completed within the female cycle. You should research any of these dates and deadlines that I've given just to make sure that these details are correct. Thyroid is, obviously we've covered thyroid and the need for the body to use iodine within the system. Thyroid has other health effects. TH3, TH4 are the hormones with regards to thyroid, and thyroid can cause quite life-changing conditions within women especially, and it does have an impact on female infertility. They also know things such as lifestyle factors, stress. Stress can prevent women from becoming pregnant. Underweight and overweight, smoking, and one that's not listed there is drinking. All these factors can have effect on the fertility in women. As previously, any issues you do not understand here, you should pause the video and you should do some research and make some brief notes. You should also be aware and make notes on how the lack of FSH can affect fertility. FSH, follicle stimulating hormone. FSH is one of the hormones, and LH, which is monitored during the menopause stage to actually tell the lady that she's actually going through menopause. So read up on what FSH is, how it affects fertility, and what women can actually do to control or actually boost FSH levels within the body. Fertility drugs. Obviously fertility, we've been looking at fertility IVF for a number of years. Early stages of IVF was not as strictly controlled as it is today, especially in the UK. In the future slides in this presentation, there are some links to websites with regards to fertility treatment in the UK and how it's controlled. As the slide says, in 1971, an Italian doctor removed 15 4-month-old fetuses, 10 girls and 5 boys, from the womb of a 35-year-old woman after she had actually had fertility drugs. None of the fetuses survived. Today, doses with regards to IVF are strictly controlled. It is a process where women have to inject hormones every day for the monthly cycle. This enables doctors to remove or harvest more eggs at an appropriate time within the monthly cycle. As you already know from previous lessons, unwanted eggs for IVF are donated for stem cell research. Obviously, there are some ethical issues there. If you can't remember stem cell research and human embryonic cells, you should take time now to pause the clip and revisit this particular stage in the Unit 1 or Year 1 GCSE course. IVF is a fertility treatment which is expensive. As a result, you often hear this on the news listed as a postcode lottery. Many women can't get IVF on the National Health Service. Depending on where you are in the UK, you can. Some of you, or some people who go for IVF treatment, may get one course of treatment free on the NHS, and any subsequent treatments they will have to pay. Generally costs around about £10,000, can be more depending on the clinic that you use. With regards to IVF now, the maximum, I understand, looking at the research out there, the maximum fertilised eggs that tend to be planted back in the womb in the UK is 2. They do this to hopefully allow the chance of the fetuses to survive, and also to prevent health risks. Obviously, there has been historical and film versions made of people such as the lady in America who gave birth to octuplets. She had 8 babies. And then obviously in the UK, a famous family with regards to IVF treatment are the Walton sextuplets, where 6 ladies, all in their 20s now, mid to late 20s, were one of the first multiple sextuplet births within the UK, and there has been documentaries made about this particular family and how it can actually affect the family. How do you get 6 babies from A to B? How do you keep 6 babies? How can you afford the nappies, the food, the clothing for 6 babies all at one time? Perhaps you would like to pause the clip and see about the Waltons. Okay, you should now pause this clip before I put the list up with regards to the causes of infertility in men, and as you watch the clip you should make notes. Okay, causes in men: low sperm count or poor quality. Poor quality can be due to alcohol, but it can also occur naturally. Problems with the tubes which carry the sperm, problems with erection, erectile dysfunction, and obviously problems ejaculating. All these can lead to problems with male. Other factors: men can have a condition called orchitis. This is inflamed testes. Past bacterial infections can actually cause scarring and blocked tubes, and that is within what they call the I can never say this word, epididymis. This is one of the tubes within the testes which joins the vas tubes within the testes, and it is one of the transport areas which carries the sperm before they are actually coated with semen and nutrients to enable the sperm to actually swim. So this is an A-level stage, but just need to be aware that the tubes can become blocked, preventing the sperm to be coated into such a way where they can actually become mature sperm and swim. Medical treatments, drug treatments can actually cause infertility, radiotherapy or surgery, and you can also have issues such as a hernia. And in boys especially, sometimes you can get what they call undescended testes, or a very painful and can be very harmful condition called twisted testes. All of these can actually have infertility issues. You've got genetic issues, as well as, obviously, as in women, you've got diabetes and also lifestyle factors such as overweight. Having a job also which includes contact with chemicals or radiation. Many years ago, TV engineers had issues or were identified to have issues with infertility through receiving radiation from TV screens or from microwave ovens. I've listed some details here for you. The HEFA website. The HEFA is the authority in the UK which licenses fertility treatment and where all the laws are specified. You might also want to visit briefly the NHS website. The Bourne Clinic, Cambridge. Obviously, Bourne Clinic was where the first test tube baby in the UK was developed, for want of a better phrase. Louise Brown, I believe that the girl was called. And then obviously you have got a couple of clips here on IV treatment processes and IVF. You should look at the YouTube clips with regards to what IVF is and how IVF treatment is completed. IVF treatment, in vitro fertilization. In vitro means in glass. That's why the phrase test tube babies has been used or coined over the years. So is a fertility treatment obviously can be free, generally tends not to be these days, and a lot of NHS throughout the UK are trying to actually make people pay for an IVF treatment. So, but obviously it is a process that women, or men and women, can go through where obviously one or both partners have fertility issues. Obviously, if the oviducts are blocked or there's an infection, in that case IVF cannot come from the female partner within a relationship. This will require obviously donor eggs to be used from another person. Been lots of law changes on donor eggs and donor sperm over the last few years, but that's not relevant for this course. It has become an issue with regards to legal issues from the point of view of inheritance, but as I said, that's not to do with the GCSE course. As I said, obviously it's not just women that can be infertile. Generally, my degree book, when I done my degree, it did state that men tend to have more problems with infertility than women. But in the GCSE book, it does say it's roughly a third of the cases of infertility are due to female reproductive systems, and also a third can be attributed to the male reproductive system. And in some cases, a third of them can be unexplained, and it may not happen. One of the cases, or one of the causes of infertility, which I haven't actually listed, I have mentioned weight as in overweight and underweight, but in teenage girls especially, or also older people, older ladies, there's a condition called anorexia nervosa. Anorexia nervosa tends to happen in teenage girls as they do not want to grow older, and unfortunately it can actually prevent girls from going through a menstrual cycle, and it can actually damage the reproductive system to the extent that not until they're in their late 30s will they actually be able to identify that this could be an issue with infertility as they get older. And in some cases, anorexia nervosa completely stops the menstrual cycle, and even if there's a recovery from anorexia nervosa, it may not actually start again. So IVF for women and for men. In the case of women, if the tubes are blocked, they'd have to have donor eggs. If not, obviously they can inject and the eggs can be harvested. Men, as I said, if they have few sperm or sperm who do not mature properly. And with regards to that, sperm can also be deformed. If it's a deformed sperm, 2 tails or 1 head, then the body, it doesn't allow it to actually be used in the reproductive cycle. It is attacked by white blood cells. So individual sperm can be injected into the egg during an IVF process. There are clips, we've seen this on stem cell clips in year 1 of the GCSE course, where obviously all this is done in a petri dish. The egg is harvested, the sperm obviously is collected, and the sperm will actually, in vitro, will actually make the egg fertile, and then when the egg is at the blastocyst stage in vitro, it will be planted into the woman's uterus and will hopefully embed into the womb lining and go on to form a full formed fetus and grow into the baby, and the woman will obviously continue with the pregnancy naturally. So we now know, obviously, with regard to the IVF, that synthetic FSH is given to stimulate the maturation of the eggs, and they'll also have to inject with LH to bring the eggs to the point of ovulation. So the lady will inject this at a certain time throughout the menstrual cycle. They then go to the hospital and the eggs are collected from the ovary of the mother, and this is done not necessarily under anaesthetic. Might be some local anaesthetic. The lady will be awake, they'll harvest the eggs, and then they will fertilise them with the sperm from the father outside the body in the laboratory. Fertilised eggs are kept in a special medium with the correct nutrients in a warm petri dish, and will allow them to actually grow into tiny embryos. They have started looking at this particular arrangement now for genetic analysis, so they can actually manipulate the genes within the embryos and obviously highlight any defective genes in certain genetic conditions. So the developing fetus will be gene free, if you like, of any harmful genes in some cases, but this all has to be done under license. The blastocyst is obviously the stage where there's minute cells within the actual fertilized zygote, it's fertilized gamete, the egg, and when it has got 1 or 2 of the embryos in the blastocyst stage, will be inserted back into the uterus, and this will obviously prevent any faulty tubes being in play when obviously this fertilized egg is planted back into the womb, and hopefully it will embed in the womb and go on to form a fully functioning baby. Obviously this is done under local anaesthetic. It requires obviously good microscopy skills and obviously a skilled consultant to implant the eggs and sperm to prevent damage to the potential new offspring. So using the clips you've seen, the information you've heard, you should make a table of advantages and disadvantages of fertility treatment. So some GCSE questions. I'll allow you to read the questions and the answers are on the following slide. part of this is obviously control of fertility. So we're going to be looking at methods of contraception. So obviously to prevent pregnancy, you have to obviously prevent the egg and the sperm fusing to create a zygote, a fertilized egg. So you should use the attached PowerPoint and show my homework, and you should now watch the 2 clips below. The first clip is obviously fertilization. It goes through the fertilization process, and the second clip is the types of contraception. You need to be aware of the types of contraception for your GCSE, the different types that there are, and obviously the different methods. So I've attached an NHS contraception clip for you to watch. So I've attached in Show My Homework some leaflets on microgygon and Yasmin. Both of these are hormone-based contraceptive pills. You should read the information there, and you should look at the medication that is involved. Is there any medication there that you recognise the names of? And you should draw a table up for the positives and the negatives of taking oral contraceptive. So when you look at the leaflets I've given you, do they tell you what the pill is for? Do they tell you how it works? And as I've already said, you should keep an eye out for any ingredients that you may recognise, which we have covered in obviously the hormone topic. You should now take time to pause the clip, and I've listed on the table some positive and negative effects of taking oral contraception. Other methods of contraception, obviously spermicides, which disable or kill sperm. These aren't effective. It shouldn't be used on its own. You tend to find spermicide is on the outside of condoms. As I said, it shouldn't be used just as a natural cream to kill sperm. It's not effective. Barrier method. Barrier method includes condoms. These are the only method of contraception that also help prevent against STDs, sexually transmitted diseases. Might also hear the term STIs, sexually transmitted infections. So if not used correctly, it can go wrong. If used correctly, there's no side effects, and they also help prevent against STIs. Intrauterine devices, the coil. These are small devices which are inserted into the uterus by a doctor. Can't be done unless you actually go into a surgery. They can last between 3 and 5 years. Some can last up to 10 years. Some of these coil devices also include copper within the actual device itself. So as well as obviously containing progesterone, it helps prevent the build-up of the uterus lining and thickening. With regards to hormone and coil contraceptive methods, the ladies can have the coil removed, can come off the hormone device, and the fertility will actually return to normal. Best method, obviously, abstinence, no sex, no pregnancy. And then obviously there's surgical methods which are very invasive and many people may take as a last resort. Obviously men can have a vasectomy where the sperm ducts are cut and tied, tend to have them after they have actually had a family. Women can be chosen to be sterilised where the oviducts are cut or tied.